Hi, this is Hannah Gearhart with Eastern University, and today we're going to talk about falls and the elderly. According to healthypeople.org, there are over 5,000 emergency room visits per year related to falls and the elderly. So this is a big issue, and the goal for healthypeople.org is to reduce the emergency room visits in the elderly related to falls, and especially those that have injury. So today we're going to talk about that, what you can do to reduce your falls risks, and also to be aware of what falls risks are there, and those types of things. So the first slide, we wanted to talk about a little bit about just add some humor to our day. So this person has clearly had an issue with falling up versus falling down. However, most people fall down through the laws of nature and gravity. But so over the next 15 minutes or so, we're going to talk about some of the objectives of what we're going to learn today about falls in the elderly. So after hearing this presentation, you should be able to summarize some of the facts of falls in the elderly, describe at least 3 falls risk factors, list at least 2 medications that cause increased risks for falls in the elderly, be familiar with vitamin D supplementation guidelines and recommendations, as well as listing some home safety modifications that can be done to prevent falls, and to demonstrate at least 2 exercises that elderly patients can do, and also state the importance of having an eye exam for patients that are at risk. So first thing is, we're going to talk about some of the falls facts. So every 13 seconds, an older adult is treated in the emergency room for a fall-related injury. Every 20 minutes, an older adult dies from a fall. And then 2/3 of those who fall will do so again within 6 months. So that's pretty significant. Next is people over the age of 65. 1/3 of those report having a fall in the past year. Less than half of those will actually tell their doctor that they had a fall, and 1 out of 200 falls result in a hip fracture, and it gets worse as they get older. So if they're over 85, 1 out of 10 is actually going to have that fracture. So some of the statistics that show, this is from the CDC website, Centers for Disease Control, indicates since 2004 through 2013 that the falls-related deaths have been on the rise. And this is a big problem, especially when there's some pretty significant things that we can do to decrease the risks for patients and their falls. So falls are the leading cause of injury or death from injury. More than half of those fatal falls involve people who are over 75. So again, it's those really seniors that are at risk for having a death-related injury. And then 1/4 of seniors who fall have a hip fracture, will die within 6 months of the injury. So again, we really want to try to prevent falls from occurring, especially those hip fractures, because they do tend to not survive them. So risk factors. So obviously there's several things that put people at higher risk for fall. So first of all, as we go through some of these risk factors, think about maybe some of your loved ones that that are elderly, that you could assist in some of these areas, and or yourself if you are thinking about your own falls risks. So first of all are any age-related body changes or physiological changes that may occur. So as you age, as patients age, the elderly age, they're going to lose their muscle function. their muscle strength, they're going to lose their balance, they're going to have more vision impairment, and then medical conditions can also cause patients' balance and level of functioning to be decreased. So that's one of the risk factors. Another factor is the environmental hazards, or things that are in patients' homes. That things is something as simple as a loose rug, poor furniture placement, poor lighting, patients not wearing adequate footwear if they're walking around with socks on without grip on the bottom. And the other thing too that patients often find is that they have this fear of falling, especially as they realize that their muscle strength has decreased, that their balance is off. So they have this fear, and then that leads to inactivity, meaning they're not as active as they used to be. Then that leads to increased weakness, and then that, they end up having a fall. Then they have increased fear of falling again, and so it's just this vicious cycle that continues with patients. So that's just one of those factors to consider. Next is medications, and we're going to discuss those here in the next few slides. So we'll go over those in more detail. So wanted to share with you a tool that you might find helpful. In the last few slides we're going to go over these the mnemonic that we put together to help you remember some of the risk factors and things that you can do to decrease your risk factors. So the mnemonic is MASHED, and I have a little handout here of what it looks like, as well as on your PowerPoint here. But first of all, we're going to go down through each one of these letters here in the next few slides, but this is also a tool that you may be able to take and share with someone who you feel would benefit. So medications, so that's the first M in the mnemonic, MASHED. So patients we know that are on 4 or more medications automatically increases their risk for falls. And it really does require a detailed look at your medications. So we call that medication reconciliation, but we really want you to be making sure that you're telling your doctor when you go what medications you're taking, and that includes anything over the counter that may be something you just take once periodically, or something you take routinely. It's so important to make sure your doctor knows everything you're taking. That may include ointments and inhalers, things like that. So make sure when you go to see your doctor, if you have 4 or more medications, always bring your pill bottles with you so that your doctor can look at them and make sure that we get the correct dosage and strength and everything marked down in your system, so that we can look at if any of their medications might be causing your risks for falls to increase. So there are some types of medications, though, that have been listed as high risk for the elderly. So these actually cause and can cause falls in the elderly. So I listed a few examples of things. The specifics are anti-anxiety medications, antidepressant medications. So Ativan, Wellbutrin, Elavil are examples of some of the brand names that you may be familiar with. Sleep aids. So if you're taking a medication to help you sleep at night, Ambien, and even Benadryl. So some of those Tylenol PMs have Benadryl in them. So that also can increase your risk for falls, because you wake up a little more drowsier than you would, or if you get up to go to the bathroom in the middle of the night, you may not be feeling as steady on your feet. Prescription pain medications are another area that big time risk for falls. Narcotics. One of the studies have shown that fentanyl has actually been found to have more injury-related emergency room visits. So that's one of the medications specifically that's targeted, but all really narcotics or pain management medications can cause those falls risks. Next is, now this is a medication that actually should be recommended to you. So you want to consider making sure you're on a vitamin D supplement, because this also is going to help calcium to absorb better in your bones, which is going to increase your bone strength and your muscle strength, balance, and then also decreasing your falls risk. So the important to highlight is the strength, because some people think, oh, the more I get, the better it is. Well, not necessarily. So with vitamin D, that is recommended that you take if you're over the age of 50, between 800 to 1,000 IUs per day, and to avoid excessive over 2,000 IUs per day. So again, it's really the right dose, not necessarily more is better. But vitamin D is recommended for patients who are at risk for falls. So activity. So physical therapy is definitely studies have been shown to help with increased patients' balance and strength, as well as if you're using a cane or a walker, we call those assisted devices, they can show you how to use them properly. Some people think they know how they're using them, but they may find that maybe the length or the height of your device may not be where it needs to be for proper posture, as well as giving you some specific things to work on for your muscles. So the recommended exercise goals is really getting 30 minutes of moderate to vigorous exercise 5 days a week. So it's really getting your heart rate up a little bit. Of course, anytime you start any type of activity, you want to make sure you ask your physician or doctor first to make sure that you are capable of doing those exercises safely, given your medical condition background. And then also doing twice a week muscle strength exercises. So those are some of the recommendations. So we want to practice this now. So what I'm going to do is show you 3 exercises that you can do at home, and then I want to practice them with you. Okay, so we're going to do some exercises together to learn how to strengthen your legs for falls prevention. So the first thing we're going to do is called a back leg raise. So basically it's what it sounds like is we're going to stand in front of a chair, especially if you have balance problems, you want to hold on to the back of a chair. The first thing we're going to do is breathe out as we lift our leg, and we're going to do our left leg first. As you lift your leg back, and we're going to hold it for a second, and then you're going to breathe back in as you bring your leg back down slowly. And we're going to do that 10 to 15 times. Again, you're going to breathe out as you lift your back leg, and for a second, bring it down slowly as you're breathing back in. And you're going to repeat the same thing on the right side for about 10 to 15 seconds. So that would be called, again, the back leg raise. We're going to do next is our side leg raise. So it's basically the same thing. You're holding onto a chair for balance, and you're going to take your left leg and you're going to lift it out to the side. Again, breathing out as you lift your leg, hold for a second, and then you're going to breathe back in as you bring it back to the front, to the floor. Again, you're going to do the right side as well, and you're going to do each side about 10 to 15 times per session. And then the last one we're going to do is just standing on one foot. So you're going to, again, use your chair for balance, and you're going to lift one of your legs. So lift your left leg, you're going to be balancing on your right, and hold for 10 seconds. So you're going to count to 10, and then you're going to switch, and you're going to do your right side up, balancing on your left leg, for holding for 10 seconds. And you want to do that for about 10 to 15 times as well for both legs. So those are some really great exercises to do to help strengthen your lower body and to help with your balance. Okay, so The next mnemonic is home safety. So you want to look at making sure that you've assessed your home for anything that could be causing a tripping hazard or be a potential tripping hazard. So bath mats, you want to make sure you have them installed or used in your bathroom, in your bathtub, installing shower rails, installing or having improved lighting, especially at night if you're getting up to go to the bathroom. Make sure you have a night light so that you can see your pathway. Removing area rugs, moving furniture around so that it's less of a obstacle for you to get around. Next is E, eye exam. So you want to get your eyes examined. Poor vision can really lead to increased falls. So if you haven't been to the eye doctor in a while, you want to look at making sure you get that scheduled. You may find that your lenses need to be corrected. That may be something as simple as that. And then lastly is D. This is kind of a surprising thing, but a lot of people are not telling their doctor that they had a fall. So you want to really make sure you tell your physician if you've had a fall, because they can really take a look at, maybe you have a condition, or maybe there's a condition that's not been known about that we want to treat, and or taking a look at your medications and maybe looking at, is there something there that can be eliminated, changed, switched, so that we can improve your safety for home. So lastly, we want to do a bit of a falls quiz. So just to test your memory and to test how well I was able to explain this to you. So first of all, the first question is, true or false? Falls are the leading cause of death from injury. That's true. Number 2, which of the following is not a falls prevention intervention? So A is exercise, B is vitamin D, C is foot exam, D is avoiding sleep aids. And the answer here is C, foot exam. So foot exam is not necessarily recommended in this specific session. However, if you do have problems with your feet, then you would want to get them examined. But this would be more specific to someone else who's having problems with their feet. Okay, last question is, what is the recommended daily dose for vitamin D for those who are over the age of 55? So it's A, 2,000 milligrams per day, B, 800 to 1,000 milligrams per day, C, 800 to 1,000 IUs per day, or D, 2,000 IUs per day. And the answer here is C, 800 to 1,000 IUs per day. And again, remembering that we want to avoid exceeding 2,000 milligrams per day. So thank you for your time, and I'm happy to share the mnemonic with you so that you're able to use that and share that with others, and happy to answer any questions that you may have. Thanks a lot. Bye-bye.